Now, a new pilot program has launched to strengthen mental health support in Dartmouth and Cole Harbour. It's called Care, Crisis Assistance and Response, and it's designed to provide in-person support to people experiencing non-emergency and non-violent crises related to mental health and substance use. Here to tell us more is Rachel Boehm, the city's Executive Director of Community Safety, and Bamadel, or Daly Bello, the city's alternate response manager. So good morning to you both. Thank you both for coming in.
Good morning. Thanks for having us.
So, Rachel, tell us a little bit more about the CARE program.
Sure. It's a partnership between the municipality, the Halifax Regional Municipality, and a couple of community service providers. So 211 Nova Scotia is the front door to CARE, and their community navigators receive the calls, determine if they are appropriate for CARE, and determine urgency or priority, and then dispatch the team. Souls Harbour is our partner to deliver the in-person mobile support. So they have a vehicle and they send a team out to deal with the non-violent or other calls of distress or social need. And then HRM oversees the program, so it is a 2-year pilot, so we'll be monitoring outcomes to determine if this program is effective and meets its goals. And we also manage the program in terms of consistency and standards for service delivery and the training of the staff, just to ensure that it's trauma-informed, effective, skilled responses, and inclusive to all citizens in the municipality.
All right, now, Daly, this program is really new, just launched earlier this month. How has the response been so far?
I'll say the response has been good. The week of the launch, we had four calls, and including one from a community-based organization that had needed support for one of their clients. So overall, I would say it's been good. It's a service that is needed, and it was, when we launched, it was welcomed with open arms.
Yes, I know there's a tremendous need for CARE. How is the CARE program a little different than what's already available out there? Maybe you could speak to that, Rachel.
Sure. So, there's been a lot of public discourse around matching people's needs appropriately to the right sort of care, the right time and the right place. So right before CARE existed, there were a couple of options: mental health mobile crisis team and 911 for emergency support. So this is meant to kind of bridge a gap of those really not acute mental health crises. Also, people in distress, maybe having a relationship problem, maybe having gone through something really traumatic and just needing a little support to get through that crisis. Our team can be there, and we're really hoping that at the end of the day, people get the care they need. It's matched to the level of their situation, and we reduce the pressures on some of our other emergency services.
Yes, and Daly, how do people access the CARE program?
Yeah, it's very easy to access the CARE program. You can call 211 to access CARE program, either as a person in crisis or a third party. You see someone who needs help and you see that this may be a good fit for the care service, you call 211, so the call is triaged. They will ask questions to ensure that it's a good fit and it is safe to dispatch CARE. Because as Rachel mentioned, CARE will not respond to medical emergencies or situations where a gun is present or other weapons, or where it may quickly escalate into violence. So once the community navigator at 211 realizes that this is a good fit for CARE, then they dispatch the CARE mobile team.
Perfect. Well, it sounds like it's just another tool to help the crisis that is out there, and that's good news. It's run through the city. What's next for the pilot program? So
it's a pilot. Right now it's 8 a.m. to 9 p.m. So come January, we're expanding to 24/7 for that geographical area. And then it'll be closely monitored for 2 years post-launch, with the goal of, if it reaches its stated goals and makes a difference for our community and really connects people to the kind of support they need and reduces the pressures on some of our emergency services for calls that are more social or distress in nature, then we hope that it will expand to serve a broader geographical area and perhaps involve more service providers.
Thank you both so much for coming in and telling us more about CARE.
Thanks for having us.
We will take a break. It's now 7:27. Your Morning Atlantic will be right back after this.